Hey Gateway family, it's Dr. Wall. Just wanted to show we're doing a series of rehab videos. I think this is going to be really good refreshers for our office. And this is going to be a video that's really good for not just if you're new to the office, maybe been in the office for a couple of weeks now and you're starting to do your rehab and getting kind of acclimated to what that looks like. This is also a really good video for those of you that have been patients for years, because what I've been noticing a lot is people not really doing rehab the way they should or the way they were told to do it when they first started, and bad habits can sneak into our lives. And after a year or two, we're kind of doing rehab the wrong way, and it's kind of not getting the best results that we want from it. So I wanted to show you the rehab, especially wobbling, because this is one that people take for granted, and it's such an amazing workout for warming up your spine, warming up your disc, warming up, you have the central tendon that it gets warmed up from your hips and attaches to your heart, so you get your heart a massage while you're warming up. So number one, we want to be doing this. And so there's different ways I've seen people do it, and I want to just kind of demonstrate that a little bit. These are ways not to do the wobble that I'm looking at because it's not warming you up very well. So I've seen people, instead of the proper way, I see people just kind of doing this. This is not warming you up. This is just going a little bit side to side. You're not warming up your disc, you're not engaging muscles. And I'm starting to see a lot of people do it that way. We got to be more engaged in that. Now, I will say this. There are some patients that have disabilities, that have maybe a hip replacement, they can't move around, and they're just starting it. We will start them off slow just to get their balance, to get them acclimated to this, okay? But if that's not you, if there's no disability, if you have no hip replacement, if you don't come in on a cane, then this is the way you should be doing it. You should be going side to side and engaging your core. This is warming up your discs. Remember, we got to get those discs hydrated and moving. So the side to side one, I'm actually giving into this, okay? You might see some people that have what we would call scoliosis. I have shown them to, depending on their curve, to really enunciate one side. If you don't have scoliosis, if we didn't talk to you about doing that, don't copy somebody else. Stay in your lane and do what you were told to do. But everybody on average should be doing this to warm up, to engage the core side to side, to warm up your back. Front to back, same thing. We're really wanting to engage our body as we're warming up. Okay, you see the difference here? Now, front to back might be a little uncomfortable when you start it, but after you do it a little bit, it's gonna start feeling really good. So we wanna go front to back like this to engage us, and side to side to engage us. These are things I've seen that are not warming you up. I've seen people just bounce up on, I don't know what that is. You weren't shown how to do that. Let's don't do that anymore. That's doing nothing for you. And then just the slow tap of a thing like this doesn't warm you up. So make sure we warm up well. 2 minutes to the side, 2 minutes front and back, unless you were told to do a little more. Some people do it longer. Do that first before your adjustment. Really warm yourself up and watch how much better your adjustment is and how much it moves easier and how less stiff you are after. So see you in the next video.